So these findings have been the cause of a concern for many women regarding the safety of soya after breast cancer diagnosis. And the studies by Helfrich have been criticized that because they have been done using an animal model and cell culture, what do they tell us? And I want to briefly go through what are the benefits and weaknesses of different model systems. In the left side you see cell culture studies, and the benefits obtained by doing cell culture studies are that they are very quick and non-expensive, and we can assess causal associations and also what are the mechanisms that mediates the effects of certain exposures on cancer cells, for example. The weaknesses of cell culture studies are that the cells are isolated from their normal environment. So when we do studies using human breast cancer cells in culture, they are just those epithelial cancer cells, whilst in the human breast, the cancer grows in the environment that has also stroma and fat cells, and the interaction between the stroma, fat cells and the tumor are is known to be very important. Then about the animal models. So the most commonly used animal model is the one that Dr. Helfrich has been using. That is the athymic mouse model, where the mouse are being inoculated with different cancer cell lines, human cancer cells. And results from those studies have been very helpful in sorting out several things related to cancer, including breast cancer. And what is the benefit of the preclinical animal models is that the experiments can be controlled very well. We know what we give to the animals, we know what we don't give to the animals, and so forth. And these have been very useful. For example, tamoxifen was discovered in a rat model that used DMPA as a carcinogen. And thanks to those studies, tamoxifen is now preventing about 50% of the women who take tamoxifen from getting cancer, and also prevents reoccurrence very effectively. The weakness of animal studies is that animals are not humans, so we can do, there are models that mimic certain aspects of human diseases, certain aspects of breast cancer, but none of the models mimics humans as humans are. They mimic some aspects of some diseases, some aspects of breast cancer. Then when we think about human studies, the benefits, if we want to know about an exposure to human health, studies done in humans are the ultimate proof, because humans are humans. But these human studies have also several weaknesses. They are very expensive to do. They take a long time to perform. For example, if one wants to know whether soya exposure affects later breast cancer risk by feeding women soya products, that study would take 20, 30 years. They are also difficult to control because we don't know what all kind of exposures and diets the women are exposed to. And then biological samples are difficult to obtain. Nobody wants to give a piece of their normal breast to be studied, and some of these studies might also be unethical, and they have to be done first using the cell culture animal models. Okay, after this, let's go and review the evidence regarding soy and breast cancer reoccurrence. 3 studies were done in 2009-2010 that were looking whether soya consumption might affect breast cancer reoccurrence. The first study was done in Caucasian women, and no significant effect was found. So soya wasn't protective, or it didn't increase the risk. And there was no interaction with tamoxifen either. In that study, you can see in the purple that the genistein levels were very low in the highest group. So it is difficult to know what was actually studied in this particular experiment, whether it was the soya intake or whether it was lifestyle related to those women who consume some soya products. And what was of concern in that study, that there was a 74% increase in premenopausal breast cancer amongst those who had the highest genistein levels, but that wasn't significant. Then there was a study done in Asian women that showed 23% significant reduction in breast cancer reoccurrence amongst those women who consumed 63 milligrams soy or isoflavones daily compared to women who consume less than 20. And you can see that the 20, the lower category, is higher than the high category in the previous study. And they also looked whether there's any interaction between anti-estrogen treatment and soya intake, and there seemed to be a reduction in risk of reoccurrence amongst the women who were taking tamoxifen, but that wasn't significant. But it went to the direction of protective effect. And the menopausal status of the women at the time they were diagnosed, or whether they have estrogen receptor positive or negative breast cancer, didn't make any difference. The third study was also done in Asian women. In that study, the reoccurrence rate amongst the participants was very high, and I don't know why that was. But in that study, it was found no effect, protective effect against reoccurrence in premenopausal women, but 33% reduction amongst postmenopausal women. And in that study, women were taken aromatase inhibitors or tamoxifen, and those who were taking aromatase inhibitors, which are the postmenopausal women, because aromatase inhibitors are not given to premenopausal women, they showed a 35% significant reduction in risk of reoccurrence. And in that study, the findings were all concerned only estrogen receptor positive and progesterone receptor positive breast cancers. Then there are two studies that were done last year, and those the first study found no protective effect or no increase in risk, and the same applies to the last study I'm showing. So to summarize these studies, there is no evidence that soya intake after diagnosis would have harmful effects. In fact, the intake seems to be reducing the risk of reoccurrence amongst Asian women, but not in Caucasian women. So experts still differ in their opinions whether it is safe to start consuming soya foods after breast cancer diagnosis. And I cite here 3 different studies. One says survivors should not increase their consumption. One says there is not enough evidence to discourage breast cancer survivors from consuming soya foods in moderation. And one says that moderate consumption of soya foods may be beneficial to breast cancer survivors. And if you go and search different websites, for example, the website of Oregon State University, this university has a big soya or plant chemical program, and they say that due to conflicting results, more research is needed to determine the safety of high soya intake in breast cancer survivors. American Cancer Society says that women with breast cancer should take in only moderate amounts, 3 servings, which represents the typical Asian intake of soya foods as a part of healthy plant plant-based diet. So I conclude my presentation with the take-home message, which is that childhood and adolescent soya intake seems to be providing a lifelong protection against breast cancer. And this, I strongly believe in this because both the preclinical and human studies show this very consistently. We still don't know why that happens, but it might be linked to the ability of the early life exposure to sensitize the breast to the protective effects of adult soya intake, because we see most protective effect if an individual consumes soy both during childhood and adult life. The lifelong high soya intake in Asian women reduces the risk of reoccurrence in breast cancer patients, and soya intake doesn't seem to have any adverse effects on breast cancer reoccurrence in Caucasian women. However, it is not known whether a woman who has been diagnosed with breast cancer and has never consumed soya before should start to consume soy daily after her diagnosis. We still need to do more studies to determine the safety of this. Thank you.